Hey, everybody. It's exciting to welcome you to another data dashboard version of our Lunch and Learn. We've got our Lunch and Learns that we host on the fourth Friday of each month, and this one's a special one. We've got some special guests here that we're going to talk to you all about work that we've been putting together and working on for about 2 years now. Exciting to kind of have this launched and ready to go for you all. We'll put a link in the chat here in just a minute. But excited to have you all as a part of this. As you know, Tennesseans for Quality Early Education is a nonpartisan coalition of advocates for Tennessee's youngest learners. We're focusing on really advancing state policies and practices that ensure all Tennessee children birth through third grade get the high quality early care and education that they need to power our state's future. As a part of that, we've started up the Bright Start Tennessee Network, which is really the statewide partnership. Our statewide network that is a partnership of communities that are closing the achievement and opportunity gaps children from birth through third grade. You all are part of that in one of those communities across the state, and we're excited to take the version of the data that we've been giving you all in community profile sheets and Excel files that we've been dumping on you and kind of turning that into a public version for our data dashboard. And today we've got some really special guests that I've come to get close to over the course of the past couple of years, meeting with them almost every week over here and there as we do with technical assistance. These are the folks from Child Trends, the Early Childhood Data Collaborative. So we've got joining us today is Carlise King. She's the executive director of the Early Childhood Data Collaborative at Child Trends, and we've got Gabriella Guerra, who is a senior research analyst at Child Trends, working as well in this project with us. So Carlise and Gabby, I'm going to turn it over to you. I'm going to highlight you all and kind of let you take it from here. And as you go through this, I'm going to drop the link in the chat to the data dashboard. But feel free to come off mute, ask questions as you want as you come along. Feel free to drop questions in the chat as well. And we will manage that as well. And then at the end, we'll save some time for questions so that as you've been kind of playing around with it, if you have any questions that you want to come off mute at the end and ask those, we would love to have those about the process or about data that you're seeing specifically. Any of those things are welcome. So I'm going to now, let's see, spotlight Carlise. I'm going to turn it over to you, and Gabby, I'm going to go ahead and spotlight you all ready to go.
Great. Thank you, Jonathan, for such a wonderful introduction. Good afternoon and good morning, everyone. My name's, as Jonathan said, my name is Carlise King, and I lead the Early Childhood Data Collaborative at Child Trends. For some of you guys that are not familiar with the Early Childhood Data Collaborative, or ECDC, as we like to call it, our work focuses on promoting policies and practices that promote the use of early childhood data to inform policy, and specifically thinking through states about strategies to build stronger early childhood data infrastructures to support integration of early childhood data, but really to be able to answer questions policymakers have about how best to respond to the needs of children and families, which is one reason we've been so excited to work with TQEE over the last years on this project. I'm happy to be joined by my colleague Gabby, who is part of our ECDC team and has worked with me and Jonathan over the last 2 years to provide consultation on the development of the state dashboard, and we'll be sharing a little bit about that in the following slides. So for the Lunch and Learn today, Gabby and I have been asked to share with you a little about our journey with TQEE to provide consultation as they work to adapt North Carolina's Measure of Success framework, and how about that process and how it now serves as the foundation for the dashboard that was just launched today. So Gabby will be walking through the adaptation process, and I'm going to walk through our approach for identifying specific indicators and data sources in order to measure progress and sort of the decision-making process around that, and also sort of the thinking and the purpose of the development of the dashboard. As a major driver, Jonathan will be chiming in throughout the presentation to share information regarding TQE's perspective on the work, but also to provide updates about the current status about different activities. I want to make sure to acknowledge our funder, the Alliance for Early Success. They fund national partners like Child Trends to be able to provide free consultation to their state allies, of which TQEE is one of, in their national network. And so they fund different national organizations to provide research, policy, and communications TA that organizations can seek out to support different policies and works that they're doing. If you'd like to learn more about the Alliance, I have their link right there on the slides, which I think will be shared after this presentation. But first, I want to hand the presentation over to Gabby to share first how TQE worked to adapt the North Carolina framework.
Hey y'all, my name's Gabby Guerra. As Carlise said, I'm a senior research analyst here at Child Trends in the Early Childhood Department. I am also a core member of the Early Childhood Data Collaborative. As a side note, I also happen to be your neighbor. I am based out of Durham, North Carolina, and I'm always super excited to collaborate with more folks here in the South and get to learn more about your unique communities. I've had the pleasure of working with Jonathan and TQEE as well as Carlise over the last couple of years, where I've helped, I've assisted the process of modifying the North Carolina Pathways to Grade Level Reading Framework. I've helped with the selection of indicators for the new framework, identifying viable state data sources, and early on I also assisted with the development of the Bright Start community profiles that y'all are using. So to kick off our presentation today, I'm just going to be giving a high-level overview of the process we took to adapt North Carolina's framework into Tennessee's new Measures of Success framework and the new data dashboard. So North Carolina's Pathways to Reading framework was originally developed by a group of experts in North Carolina to help them track progress towards grade level reading proficiency using a set of associated research-based measures. So over the last 2 years, we've assisted TQEE in adapting this framework to guide the work of the Bright Start initiative, and we have added the additional goal of increasing grade level math proficiency rates as well as reading proficiency rates. The framework itself is organized into measures of success, all of which are research-based indicators, as I noted before, and these indicators are used to quantify our progress towards the measures of success. The measures of success are essentially the results that we're trying to achieve to support our overall goal of grade level math and reading proficiency. So on the next slide, the work that we've done with the data dashboard in Tennessee has pretty significant overlap with the North Carolina framework, but we have modified some components of it based on pre-identified community needs and state level priorities that Jonathan communicated to us. I know Jonathan has already kind of reviewed the components of this with y'all before, so I'm just going to be going through the pieces that we adapted. So just as a reminder, some of the core components that we've adapted from the North Carolina framework are: 1, the vision that's at the center of the framework; 2 are the goals that support the framework vision; and then 3 are the measures of success that help us measure our progress towards the framework vision. So you want to head back to the vision slide, just next slide. So at the center of the framework, we have the vision, and this is the overall goal, the vision that's guiding our entire framework. So while North Carolina's framework was developed to improve literacy rates within the state, Tennessee's vision broadens this goal to include 3rd grade reading proficiency and math proficiency, as noted in the little circle on the left with all the cute little icons. On the next slide, the ring that's one level out from the center is indicating the overarching goals that research says children need to reach the main vision. For Tennessee specifically, we've simplified the 3 goals that North Carolina had, and these are the buckets of our indicators that support our vision, but we've simplified these to high quality early learning, so high quality birth through age 8 learning environments for all children, health and development, or physical health and mental health and development that are on track from birth, and then finally the family and community bucket, which is supported and supportive families and communities for all in the state of Tennessee.
And I'll jump in real quick, Gabby, and just say this is what our Bright Start community is very familiar now with calling domains, right? So these are the domains that we all know that kind of create the cycle of success. This is where they've organized work groups around this and created entire strategies that all fit under this. So keep going. Sorry, just want to jump in and add that commentary.
No, I want to make sure to use the language y'all are using, so I will refer to it as that throughout. On the next slide, so this ring the third ring outlines the measures of success, or our indicators that are providing our evidence-based support for the 3 outlined domains that are supporting the overall framework vision. So you can see here in this image how specific indicators are color-coded in alignment with the progress goals, all of which support the framework vision. And if you're interested in learning more about the specific research rationale that North Carolina used, you can go visit the North Carolina Pathways to Reading Framework website if you have not seen it yet. On the next slide, the measures of success that you can see on the screen now are what we've helped develop in partnership with TQEE and what are currently outlined on the brand new data dashboard. The blue row represents the early care and education domain. The red row is comprised of all of our health indicators, and the yellow row outlines all of our community indicators. It's worth noting that each of these boxes represents one measure of success, but each measure of success might have one or more actual indicators that we've identified to help us track the measure of success. So how do we define our indicators? On the next slide, the data action team in North Carolina that helped develop the original framework, they identified a set of criteria to determine which measures to include in their framework. And we really liked their criteria, so we adopted these same criteria to inform our own work in Tennessee. We've worked to identify research-based indicators that are both actionable and impactful, can be easily communicated, and work to decrease inequities. So for instance, it's well documented within the literature that school attendance impacts children's learning and future life outcomes. Attendance is a concept that is easily understood and can be pretty easily communicated to parents and other key stakeholders. Attendance is also something that we could reasonably work to improve through policy change and other practice changes. We know that children attending school on a regular basis will have a positive impact on their learning and social development. And through data, we can also track group differences to help us identify where inequities exist so that we can target our efforts towards communities that are most impacted by chronic absenteeism. So this is a logic that we've used to help select indicators for the data dashboard that are going to be best suited to serve the Bright Start communities and also the larger state of Tennessee. So now that I've gone through the background and framework that we started from, Carlise is going to talk a bit more about our actual process for identifying the specific measures of success for Tennessee.
Thank you, Gabby. I'm going to go off camera just to preserve my bandwidth a little to make sure that I don't get disconnected, but we'll come off if people have questions. And Jonathan, please let me know if there are questions that come up in the chat and I'll be sure to stop.
Will do.
Thank you. So thank you, Gabby. So as Jonathan said, in order to do this translation, so I think like we adopted the framework, and then there was a goal of going through a process of translating these indicators associated with these domains into metrics that would allow local and state leaders within Tennessee to measure progress around each domain. So, and this process really required a lot of times when we're working with states, we really want to start with the questions that you're trying to answer, the goals that you're trying to reach, because all of those things frame ultimately the type of data that you're trying to collect and how you want to be able to display that data to support people in action. So next, I'm going to talk about the priorities that TQEE communicated with us as part of the process and that we used in order to identify data that could be actionable and that aligned with the priorities within its communities. So first, just talking a little bit about the process for identifying measures of success for Tennessee. First was figuring out, well, which indicators would Tennessee need to adapt and which ones would they need to further define or revise? North Carolina did extensive stakeholder outreach and community engagement to develop this framework, but some of the indicators that they identified were more aspirational, meaning they may have defined them but didn't have a specific plan for how they would be able to capture or measure it, but really putting it out there as a goal. So in some cases, Tennessee was able to adapt some of the indicators that were there, but in some, they needed to take those aspirations of North Carolina and define what that meant in Tennessee. So what Child Trends did in sort of step 2 was working with TQEE to identify national and state data sources, such as the US Census, state level reports, national surveys that may capture some of the indicators that they were trying to capture. I'll talk a little bit later about the priorities in terms of being able to disaggregate the data by different populations and how this made some national data collection efforts ineligible to be able to use because they couldn't provide the level of detail that was needed to really support local efforts. However, through the process of scanning all the national and state data that's collected, we were able to document relevant sources and identify tools and questions that could be used to guide additional data collection. The third step was to identify methods for capturing data that was not publicly available, but did exist. So I have to give a lot of kudos to Jonathan because he had many meetings with departments of health, education, intervention and dental services to understand potential data that was being collected within the state, but may not be publicly available. And this was a really valuable investment that really helped to strengthen relationships to support not only current, but potential data needs that you may have. And then the last step was to where we could not find publicly available data at the national or state level was to propose new strategies for how data that didn't have a current source. So TQEE has a regular parent survey that they mentioned to us several times that they use as a vehicle in order to collect data that either wasn't available or wasn't collected in a way that was going to be actionable for communities. And we were able to use survey items from nationally developed tools in order to support additional data collection at the state level. So I'm going to go through a quick example. So here's an example of an indicator where Tennessee needed to translate this into sort of the goals and the work that they were doing within their communities. So for the supported families, North Carolina defined this as the percentage of new mothers reporting access to sufficient social support. Sufficient social support can be defined in many ways, but I think one of the key differences between the goals in North Carolina and what TQE was trying to accomplish is that they didn't want to limit this indicator to only new mothers. And so it's something that they wanted to be able to understand for all children and families and not only new mothers. So we provided several examples of different ways that sufficient support had been defined in other surveys and reports. And after reviewing that, there was a decision to focus on a measure that would capture a family's ability to pay for basic needs. So really thinking about it from a financial perspective, and if that parent felt like they had sufficient support. So thinking about it from two different angles. And we were able to share examples from the census's pulse survey that asked specifically questions about families' difficulties paying for household expenses. And this is a tool that was developed specifically during the pandemic to assess parents' needs around health, financial, and other community supports. So these survey items were adapted and included in TQE's parent survey. Next slide. So you'll see here is the final result, and hopefully you're checking it out on the online dashboard as well. And it ended in a measure of parent and caregivers of children under the age of 9 that reported either having no difficulty paying for household expenses or reporting having sufficient support. So thinking about WIC, SNAP, Tennessee Care, food pantries, et cetera, in terms of the types of supports they asked about. So For all of the indicators on that screen, we went through this process. And so I'm going to hand it over to Jonathan to share a little bit about where we are with the status of the different indicators, now that you have a sense of the process. Jonathan?
Absolutely. Yeah. Thank you, Carlise. Yeah. So the first slide here, again, shows kind of the larger framework that you can see with the 3 domains, the 15 measures. The ones that are highlighted in green here have information from them from a state source. So whether it's Department of Education, the first 2 come from that. Then we've got Department of Health that have provided that for healthy birth weight and several of the early intervention. And then we've got oral health, which actually came from our Casey Kids Count folks with TCCY that provide this data. And then the safe at home and early intervention as well come from state sources. So these are kind of just a larger overview or snapshot of kind of where that comes from on the state side. The next group is actually the indicators that we captured through our parent survey. So the parent survey actually covered 6 of them, but the one that is missing here is the positive parent-child interaction, which is still not quite where we want it to be, and so we're not displaying that as of now. And then that leaves the remaining ones that are left over are not captured yet. So we've got coming soon on several of these. We're in partnerships or in talks with the Department of Education on some of the ones at the top with grade level proficiency. We're hoping very soon to work out a data trust with them on both to cover out the data level proficiency for pre-K through 2nd grade and the summer learning data. I'm in conversations with several of you, even some that I see on this call, to work out the positive early care and education climate data. Several of you have helped out with the folks from AIM High and TECTA and CCR&R are working to help us try to identify some data that we can pull from 10PAL to get us a good indicator from that. Oral health is circled here. It does have some data, but if you'll look at the details there, the reason that one's on here is because we have data around the number of dentists per capita, which is a proxy indicator that we have here. It does not cover the full picture of what we hope to see in regards to looking at true oral health of children. And then that last one that I mentioned, we covered in the parent survey, the positive parent-child interaction. We didn't display this data and we didn't publish it because the information that we received back from the parent survey doesn't seem to match national trends and other statewide data that we have from the ATUS, census data, et cetera. So we're not comfortable publishing the data that we got from the survey on that specific one, but we're continuing to work with Carlise and Gabby on that to try to find other ways to capture this in the future. But all those say coming soon as of now. All right, I think I'm turning this back over to Carlise to talk about the identification of data and disaggregated by populations.
Sure. Before I go into priorities for disaggregating the data, were there any questions that came up?
Not so far. We've had a couple individual ones, just one-off that I've answered through personal chat, but so far I think we're still waiting for people. They must be playing. They must be playing and exploring the data dashboard, and hopefully we'll have some good questions here at the end.
Well, that is great because my motto is data that is used always gets better. So please play away. So next, I just want to discuss a little bit about our goal to identify data sources that would allow for the disaggregation of data and how the priorities of TQEE around this issue. So I know a lot of you guys use data all the time. I think one of the things that we emphasize at Child Trends is the importance of breaking apart data and how that really helps to understand disparities and the degree to which certain groups are experiencing those disparities. And that doing this really allows for the alignment of policy responses, as well as the allocation of resources based on where there's the greatest need. So as we were in conversations with Jonathan and team, it was identified really 4 key ways. Obviously, there are other ways that also want to disaggregate the data, but in terms of if we're prioritizing data source, there were sort of these 4 key ways they wanted to understand each of the indicators. The first was that they wanted to understand it by age, so really focusing on children birth through 9. But because data collection may focus on a subset, maybe 0 to 5, or on a larger age span, such as under 18, there were instances where there was a desired indicator was available, but the ages that we needed were not. In some cases, we move forward with it without the ideal age range, but in instances where really making sure that it was prioritized for that age range, other methods for collecting that indicator were identified. The other groups were also race and ethnicity, children experiencing poverty, geography, which was a priority to have at least county level data so that the data could be actionable to the Bright Start communities. This was really tricky at times because some indicators would only be available at the state or the regional level. But whenever possible, we tried to identify county or district level data. And when that wasn't available, to then identify methods to either get it from the state directly or to collect it through the parent survey.
The one thing I'll add to that, Carlise, before we go to the next slide, is that we wanted to provide that, and there's several places where we had data at the county level that we actually took another step to aggregate that back at the 2 regional levels. So when we look at the Bright Start area, some of the plans within Northeast Tennessee and West Tennessee, it really is looking at a regional plan. And so we help to kind of bring that back together and provide regional numbers in that case as well. So we wanted to always disaggregate as much as we could and get down into the weeds, but there's a couple cases we actually brought that back up and provided composite level regional data for those as well.
No, that's a great point. And I think the other thing, and I'll talk about this a little bit in communicating the data, is that we're always wanting to think about intersectionality, but there were instances where, we were providing feedback on disaggregating the data at the level that was desired caused privacy and security concerns. So once you're getting down to very small sample sizes for particular populations, we actually recommend not displaying that data in something such as a data dashboard. So we had several conversations back and forth about different data sources and really deciding not to maybe utilize something because there were concerns about data privacy.
That's good.
So in thinking about breaking apart the data, I figured it'd be good to walk through an example and take the case of chronic absenteeism, which Gabby mentioned earlier. So you'll see in this chart that children described as that the statewide percentage for children that miss 10% or more of school is just above 12%. However, without breaking the data apart, you don't see the whole picture of what is happening. In advance. In this case, you see the chart in this chart that children described as economically disadvantaged in the orange are chronically absent double the rate of the state average. And I use this example to illustrate that if we don't break data apart, our understanding of the problem is incomplete. And really that breaking apart the data helps us understand really the experiences and where to kind of target resources for those for a particular issue have the greatest needs. And so in this case, it's broken out by race and ethnicity, income, as well as disability status. And if you go to the next slide, which gives you kind of the snapshot of the dashboard if people haven't dug into this one. This data is also able to be disaggregated by district and by grade level. So I think this is an instance where this indicator is really able to be dug into by all of these different levels to understand local and different group differences around attendance. We would love this for all the indicators, but we were not able to get there. But I think it gives you an idea of sort of that goal and that North Star that we were sort of working for. So here's a screenshot of the table on the data dashboard. Oh, no, I did that one. So next I'm just going to talk about the selection of the indicators and how and why a data dashboard. So we often talk to different clients about how to communicate the data that they collect. A dashboard is only one of many ways that data can be communicated. So as I mentioned before, a lot of times it's thinking about you want to how you're communicating your data is going to depend on your audience, the type of data that you're communicating. And in this case, TQEE wanted to share their data so that it could be used by policymakers, Bright Start partnerships, and other practitioners. And generally, the purpose of a data dashboard is to allow folks to have a common language around what helps children succeed and to be able to look at progress over time at a high level, so that, say, for policymakers, they can track trends around potential to inform policy solutions, thinking about effective practices and policy changes to prioritize interventions. Bright Start communities can use these data to inform strategic plans that align to the service needs of families, and that practitioners can be thinking about program design or outreach strategies utilizing the data. So these are meant to generally be more population-based, to capture trends and to give a sense of whether or not you're working toward, you're meeting a particular benchmark or goal. Next slide. Another part of our work with TQEE was sharing some of the guidelines and recommendations that we provided about how to communicate data equitably. I cannot go through all of these in detail, but I would like to give you at least an example of each. So we shared these with TQEE and provided feedback around applying these different principles. The first is saying what you mean and using person-centered language. And so for this, we mean being clear and specific when describing populations and not labeling children or families based on their circumstances. So labeling groups by their circumstances, as we know, can be stigmatizing and something that we just want to avoid. So for example, describing children at risk versus stating what we mean, which is children that are experiencing homelessness. This is something that we're working on because we know within some of these data systems, these labels are being used. So I think part of that is translating all of this as you're sharing the data. Another is to not center one type of person or experience as the norm. And we need to just be aware of how our own biases, consciously or unconsciously, assign positive and negative values to groups and people. And that comes out in what we choose to emphasize in our data and what groups we use for comparison. So again, whenever using any data, it's important to say why you're displaying it the way that you are. So not in a way that assumes group differences, but also why you're choosing the metrics that you're choosing to capture that. So an example is, instead of using white children as the default comparison without explaining or talking about when you're talking about closing the achievement gap, we recommend, really communicating a desired outcome, such as performing at grade level for all children as the comparison. And then also the importance of acknowledging intersectionality within all of the groups when presenting and utilizing the data. We all hold multiple identities. I am Black, I am also a woman, and my experiences are shaped not just by one, but all of my identities. So we also think about, while we the importance of disaggregating the data, we know that children may fall into one or more of these groups, and really putting context around what that needs, which gets to the last one, which is putting the data in context. We can't just present data, and we want to avoid presenting data that allows the reader to fill in the blanks and regarding why a disparity might exist in our data. So we talk about the importance of putting the data in context and really thinking through in looking to research about what institutional policies or practices may have affected specific groups. So for example, when sharing data about health disparities, including context about the lack of health insurance. So in the final slides, I'm going to hand things back to Jonathan. He's going to share a few more of the dashboard slides to talk about the examples of data shared to support policymakers, community, and then how we're trying to communicate data that's needed, but still in progress. So Jonathan, I'll hand it over to you.
All right. Thank you so much. So again, I'm hoping at this point that you've dug in and are playing around with all this, and instead of switching over to kind of a live screen grab and watching that, hopefully you're doing that, but I'll just give you a couple of screen shares of images from the data dashboard. And the first one here is really the kind of the intro at the very bottom of kind of the explanation. There's the third grade reading proficiency. And again, this is one where you can look at, if you hadn't seen this already, you can pull the drop-down menu. Like Carlise said, you can look at this disaggregated by everything that TDOE, Department of Education, allows for. You can also switch back and forth between ELA or English language arts and then math. The way that we frame this and have been giving you all community information sheets, et cetera, is kind of in the same format, where it shows everything to the right of the bar is essentially is passing or proficient. It's the meets expectations or exceeds expectations. And then everything to the left of the bar is below or approaching. I will make a pause and say that this is all data from school year 21-22. Obviously, they are just now releasing some of the initial rounds of data for school year 22-23. And as soon as that becomes public, we will, as fast as we can, get this updated and have future years included to where you can slide through maybe a slider bar or something like that and compare previous years. But again, you get an idea here of, you can select, excuse me, by the region. If you go down and scroll a little bit further down on the page, you'll be able to see where you could select specifically a region and then break it out into looking at the exact school district level data. So this is an example that we have on the main page. The second one that I have here is just to kind of highlight what Carlise was mentioning here, is around healthy birth weights. And on this one, when you click on the data, you can look at it and see that broken out two different ways. I'll highlight on, and the reason we've kind of pulled this one up to highlight it is to look at the four different columns that we have of information here in regards to Black and white, and then Hispanic and non-Hispanic. The way that the Department of Health reports this information is not mutually exclusive. So these are not four separate categories, but rather they're two kind of columns of categories that can be compared to each other. So there's the Black and white that can be looked at next to each other, and then the Hispanic and non-Hispanic that can be looked at next to each other. And then we've got the total as a kind of relative column in the very last column there. And then the last one that I pulled up is an example of the early care and education. I mentioned this earlier when we were talking about this, but we wanted to highlight this. One of the things that we've been encouraged by several folks as we have gone to publish this is that even though there are pieces of information that may not be where we want them to be, it actually is worthy of publishing that exact statement, right? So this is not where we want it to be, but we are continuing to work on this. We're engaging with national and state partners to really push forward more and more to get better data. So this in and of itself is a storytelling mechanism to say, hey, we don't have exactly what we want it to be here, so that we can make informed decisions, but we want to give you everything that we do have as we've got it. So I want to kind of go ahead and go to the next slide. I think I've got just a couple more here. I'm going to take the slide deck down and open it up, where if you've got questions, love for you to come off mute. We'll unhighlight or spotlight ourselves, but we've got just, again, a big thanks to Carlise and Gabby for the work that they've done here. I will throw up one last thing just real quick so that while my slide deck is up, next month we are jumping into where we're doing a show and tell specifically, and we're going to start this. Every community is going to have an opportunity to do this. So Chattanooga has volunteered to go first. They're going to show us a little bit about what they're excited to talk about, and you'll get more information on that in the coming weeks. But that's our topic for our next Lunch and Learn. But I'm going to go ahead and stop sharing my slides here. All right, and then I'm going to unhighlight us, but love for you to come off of, turn your video on if you can, or even if you just want to come off mute or put something in the chat. Would love to hear any questions that you all have for Carlise or Gabby, the team. This is, when it comes to data and everybody's like, ooh, we love the data that TQEE gives us. Like, it comes from these two right here. They are the ones that are helping us to gather this stuff and make sure that what I say to you is actually accurate and right, and is framed the way that it needs to be. So this is your chance to ask some good questions.
Jonathan, you put so much work in this. I would flip the ballots a little. We consulted, and Jonathan did a lot of the heavy lifting, but I think was really exciting about this process is really the effort to understand like the goal of the data and then trying to identify the right source and the right way to capture that. But I was on another call before and you're like, sometimes perfect is the enemy of good.
Right.
And I think Jonathan and team were very committed to moving forward and adjusting, right? Like people can't react to something that doesn't exist. So I think seeing how this grows and improves as communities use it is something that's very exciting.
That's great. All right, questions that you guys may have. I got a lot of people here that I know have questions. I'll start calling you out if you don't. Beth's coming on. I knew Beth would have a good question for us.
No, well, I don't know
did.
that it's a great question, but first of all, I love this. I think it's awesome. And it's a lot of what we've talked about in other settings. So it's great to see it come to fruition. So I do have a question. In the section about grade level proficiency pre-K to second grade, how are we going to pull that information? What will be the measurement for that?
Mm-hmm. That's a great one. So we're working with two different entities, working with the Department of Education, and then we're working with the Tennessee Reading Research Center. A year and a half ago, Bill Lee had signed into place, actually 2 years now, the Literacy Act that requires every district to have the Tennessee Universal Reading Screener. So at some level, everybody has to have one of 7 selected screeners. We're gathering the information from those screeners, and that is what we are going to use as a proficiency measure. And this is where you can help me with this, Beth. I'll turn it back to you. I know that second grade, first, and kindergarten have levels of proficiency within each of those 7 screeners. I'm not sure that exists at a kindergarten or at a pre-K level. So I'll actually defer back to you on that one.
So in our district, we give our preschool students the RAN.
Mm-hmm.
It's the rapid automatized naming
Mm-hmm.
assessment, which is normed for preschool. And that, difficulties with that RAN skill has connections to children having difficulties later on in reading. So there's a really great connection between the RAN and the performance in those other measures that we use from kindergarten on. Right now, AimsWeb is not normed for preschoolers.
Yep.
So we would have to be compared to the kindergarten norms.
Yeah.
But I heard it was a possibility that there may be some more work to have that information normed appropriately for preschool. Because right now, if we gave that, all of our kids
right
wouldn't score well. That's not
that makes sense. And so probably what you'll see as we roll this out, if we have the K1, 2 proficiency data from the different screeners, probably what you'll see is a note clarifying that we need to continue to further gather more data around either norming those screeners for pre-K or finding something else in place of that. That's a great point. Thank you, Beth.
Yeah. Well, I just think that's super important, and I'm hoping that happens because it's hard to, in a large district, it's hard to track the progress of our preschoolers once they get into school. We might have a child who moves 8 times between preschool and 3rd grade. And so it's not always really easy to track, but if we had them in AimsWeb, we can track them. So my hope is that will happen for us and make that process a little easier all around.
That's great. Thank you. Other questions? All right. You guys are being a shy bunch today. I told Carlise and Gabby that you would have some great questions for us, but I think we got a shy group. Maybe you're just in the process of just playing and exploring with the data. That's the story we're gonna tell ourselves here. That's what Gwendy said in the chat. I did get another question from somebody. Do you know if this was written just to me? Do you know if other states have a similar or as robust dashboard? There are lots of states that contain dashboards. Part of the Alliance for Early Success. We see them all the time, kind of updating those and putting those out. I have not seen one. So North Carolina has their frameworks that they put up, their pathways for grade level reading, that they have a similar thing. But as far as this covering this kind of wide topic of things, I haven't seen it. Carlise and Gabby, I would turn to you all. I know that like several folks have childcare data dashboards where they're diving into a specific aspect of early care and education, but I've not seen one that kind of covers all of these different 15 domains.
I think there are a lot of different dashboards, I think at the national level, at the state level, and on the local level. I know we pulled a lot of them in our scan initially before you landed on the North Carolina's one that you wanted to adapt because it was really covering the different domains that you were thinking about. So I think it just depends. I think the focus on health, community, and early care and education is a unique kind of framing of this one, because you might have one that's on early education, but it focuses really on health indicators, ones that really focus on like supply indicators. So I think there's a lot of dashboards, but I think the questions that they're trying to ask and the populations that they're focusing on is what varies. But it's helpful because then you're like, if it exists in this dashboard, then I can pull it into another dashboard. So, and one of the things I know for North Carolina, they're actually revising and relooking at their indicators, which is, again, an important thing to do as you're utilizing them. And so we had an initial call with them to talk about TQEE, to be able to share what they've learned in adapting theirs, and then to hear from North Carolina as they're revisiting their framework as well. So I think there's an opportunity ongoing. I was trying to look at the resource the Alliance had with the list of data dashboards. So if I find that in time, I'll try to put it in the chat or share it with you, Jonathan, because we had provided them a list of examples of ones that we've collected.
And I'm happy to share that out afterwards. Well, we are 2 minutes past time. I want to thank Carlise and Gabby again for all the work that they've been doing, but then also graciously agreeing to come on and share a little bit more about this and give us a presentation. I'm going to put in the chat the meeting for the registration for next time to see some of the work that Chattanooga is doing, and we'll send this out by email along with the recording. But the dashboard is live now. I've got at the very bottom of every page an opportunity for you to email if you have any questions. If you see any mistakes or typos, this thing gets better when you provide feedback. We don't want to hear just the good stuff, but we want to hear it all. So let us know where you think this could be improved, where you see things that might need to be adjusted, or if you've got questions, please feel free to reach out to us, data@tqee.org. In the chat, you've got the information there. Just want to say thank you again to our friends at Child Trends for all the work that they've done. And I'm going to stop recording now.